autism spectrum, you know? Yeah. So you talking about autism, so I'm gonna ask this robot right here, what is autism? What does it do? What is it capable of?
Autism, or autism spectrum disorder, ASD, is a developmental condition that affects how a person's brain works. It's called a spectrum disorder because it affects people in many different ways and to varying degrees. Here
Okay.
are some key characteristics of autism. Social communication and interaction challenges. This is a core aspect of autism. People with ASD may have difficulties with social interactions, understanding and responding to social cues, engaging in back and forth conversations, sharing interests, or understanding others' thoughts and feelings. Communication, making eye contact, using or understanding body language and facial expressions, or having an unusual tone or rhythm in their speech. Some people with autism are nonverbal or minimally verbal. Building relationships, difficulty making friends or relating to peers. Restricted and repetitive behaviors, interests, or activities. This can include repetitive movements, like hand flapping, rocking, or spinning, sometimes called stimming. Insistence on sameness and routine. Becoming distressed by changes to routines or plans. Highly focused interests. Having intense and often unusual interests in specific topics or objects. Sensory sensitivities. Having unusual reactions to sensory input, like sounds, lights, tastes, smells, or textures. Either being overly sensitive or undersensitive. It's important to remember that autism is lifelong. It's a condition someone is born with and it doesn't go away.
Okay.
However, the needs and challenges of an autistic person can change over time, and various therapies and supports can help. No two autistic people are exactly alike. The spectrum means there's a wide range of strengths and challenges. Some autistic people may need significant support in their daily lives, while others may live independently. It's not a disease to be cured. The goal is not to cure autism, but to help individuals develop their strengths, manage challenges, and lead fulfilling lives. If you have more questions about autism, feel free to ask.
No, what is this mental health called bipolar? So what is bipolar and what does it do?
Bipolar disorder, formerly known as manic depression, is a mental health condition that causes extreme shifts in a person's mood, energy, activity levels, and concentration. These shifts are much more intense than the normal ups and downs everyone experiences. What does bipolar disorder do to a person? Bipolar disorder primarily causes individuals to experience distinct periods of emotional highs and lows, known as mood episodes. These episodes can significantly impact a person's daily life, relationships, work, and overall well-being. Here's a breakdown of what these episodes involve. 1. Manic episodes, emotional highs. During a manic episode, a person may experience extreme euphoria or irritability, feeling
Okay.
incredibly happy, excited, or high, or conversely, being extremely irritable, agitated, or aggressive. Increased energy and activity, feeling
Okay.
tired, restless, or having an abnormal
Okay.
amount of energy. They might engage in many activities at once or feel a decreased need for sleep, feeling energetic even with little to no sleep. Racing thoughts and rapid speech. Thoughts might race through their mind, and they may talk very quickly, sometimes jumping from one topic to another.
Okay.
Impulsivity and risky behavior. Making poor decisions without thinking them through, such as excessive spending, engaging in risky sexual activity, or making grand, unrealistic plans. Inflated self-esteem or grandiosity. Believing they are very important, powerful, or capable of anything. Distractibility. Easily losing focus and being pulled in many directions.
Okay.
In severe cases, psychosis. Losing touch with reality, experiencing hallucinations, seeing or hearing things that aren't there, or delusions, believing things that aren't true. This is more common in bipolar 1. 2. Depressive episodes, emotional lows. During a depressive episode, a person may experience profound sadness, hopelessness, or emptiness, feeling deeply down, tearful, or having a pervasive sense of despair. Loss of interest or pleasure, no longer
That's
enjoying
bipolar.
activities they once loved. Changes in appetite and sleep, eating too much or too little, and sleeping excessively or having difficulty sleeping. Fatigue and loss of energy, feeling constantly tired, drained, and having difficulty with even simple tasks. Feelings of worthlessness or guilt, experiencing overwhelming self-blame or feeling like a burden. Difficulty concentrating, remembering, or making decisions. Brain fog and impaired cognitive function. Thoughts of death or suicide. In severe cases, suicidal ideation or attempts. Types of bipolar disorder. There are several types of bipolar disorder, with the main ones being bipolar I disorder, characterized by at least one manic episode. Depressive episodes are common but not required for diagnosis. Manic episodes can be severe enough to require hospitalization. Bipolar II disorder involves at least one major depressive episode and at least one hypomanic episode. Hypomania is a less severe form of mania, where symptoms are noticeable but don't typically lead to significant impairment or require hospitalization. Cyclothymic disorder, cyclothymia, a milder but more chronic form of bipolar disorder characterized by numerous periods of hypomanic symptoms and depressive symptoms that last for at least 2 years.
That's
1 year in children
stuff.
and adolescents.
Long
The
shit.
symptoms are not severe enough to meet the full criteria for manic or major depressive episodes. Causes of bipolar disorder. The exact cause of bipolar disorder isn't fully understood, but it's believed to be a combination of factors. Genetics. Bipolar disorder tends to run in families, suggesting a genetic predisposition. Brain structure and function. Differences in brain chemistry and the way certain brain circuits work may play a role. Environmental factors. Stressful life events, trauma, and substance abuse can sometimes trigger episodes or contribute to the onset of the disorder in genetically vulnerable individuals. Living with bipolar disorder. Bipolar disorder is a lifelong condition that typically requires ongoing management. However, with effective treatment, which often includes medication, like mood stabilizers, and therapy, like psychotherapy, people with bipolar disorder can lead stable and fulfilling
this shit
lives.
on for me, G.
It's crucial for individuals experiencing these symptoms to seek professional help for diagnosis and treatment.
Okay. So what's narcissism? What's a narcissistic person?
You're hitting on some really significant mental health concepts here. Let's break down narcissism and what defines a narcissistic person. What is narcissism? In everyday language, narcissism is often used to describe someone who is very self-centered, vain, or overly concerned with their appearance. While these can be traits, true narcissism, particularly when it rises to the level of a mental health condition, is much more complex. At its core, narcissistic personality disorder, NPD, is a mental health condition characterized by a pervasive pattern of grandiosity, an exaggerated sense of one's own importance, achievements, and talents, often believing they are superior and unique. This can manifest as bragging or making up or exaggerating accomplishments. A constant need for admiration, a deep hunger for praise, attention, and validation from others. Their self-esteem is often fragile and relies heavily on external affirmation. Lack of empathy, an inability or unwillingness to recognize, understand, or identify with the feelings, needs, and perspectives of their own needs. Sense of entitlement, an unreasonable expectation of especially favorable treatment or automatic compliance with their wishes, believing they deserve special privileges. What is a narcissistic person with NPD? A person with narcissistic personality disorder will consistently display a pattern of the traits mentioned above across various areas of their life, relationships, work, social situations. It's not just an occasional moment of selfishness or arrogance. It's a deeply ingrained way of thinking and behaving. Here are some common characteristics and behaviors you might observe in a narcissistic person. Belief in superiority. They genuinely believe they are better than others and should only associate with other special or high-status people or institutions. Fantasies of unlimited success, power, brilliance, beauty, or ideal love. They often live in a fantasy world where they are the best, most powerful, or most loved, even if reality doesn't support it. Exploitative behavior. They may take advantage of others to achieve their own ends without guilt or remorse, seeing others as tools to get what they want. Arrogant and haughty behaviors or attitudes. They can come across as condescending, snobby, or disdainful towards others. Envy. They are often envious of others' achievements or possessions, or they believe that others are envious of them. Difficulty handling criticism. They react very poorly to any perceived criticism or slight, often with rage, contempt, or by belittling the critic. Their fragile self-esteem is threatened. Charming initial impression. Ironically, they can be very charming and charismatic at first, especially when they are trying to impress someone or get something from them. This can make them difficult to spot initially. Blame shifting. They rarely take responsibility for their mistakes or failures, instead blaming others for their problems. Control and manipulation. They may try to control situations and people around them to maintain their sense of superiority and to ensure their needs are met. Important considerations. Spectrum of severity. Like many personality traits, narcissism exists on a spectrum. Many people may exhibit some narcissistic traits without having NPD. The disorder is diagnosed when these traits are pervasive, inflexible, cause significant distress or impairment in functioning, and are not better explained by another mental health condition or substance use. Underlying insecurity. While they project an image of extreme confidence, people with NPD often have a very fragile sense of self-worth and deep-seated insecurities. Their grandiosity is a defense mechanism against these feelings. Diagnosis by a professional. Only a qualified mental health professional can accurately diagnose narcissistic personality disorder. Challenges in relationships. Due to their lack of empathy and exploitative tendencies, people with NPD often have very turbulent and damaging relationships. Understanding narcissism is crucial because interactions with narcissistic individuals can be emotionally draining and harmful. If you suspect you or someone you know might have NPD, seeking professional help is important.
Please seek professional help if you have NPD. You need to seek professional help. Reason why I brought this up, a whole lot of my friends, a whole lot of people I know, mental, they might have autistic, they got their ways, and we all got our ways. We all got our mental ways. Some bipolar, some narcissistic, some bipolar, but powerful mental issue that a lot of people don't know that they have. Anxiety, stress disorder. And it's good if you be aware of what you have. It's good for you, your friend, your family, whoever is in your family to be aware, because sometimes people act certain type of way and that's not the way you expect them to act, or you think some people not supposed to behave that way, but due to the fact of their mental disorder, they act the way that they act. Maybe you're not aware of it. Sometimes they're not aware of it totally. So something needs to be looked into. A whole lot of kids on the streets, people on the streets, people all over living their life and wonder why things are this way, or people not seeing eye to eye. Some mental issue going on, which a lot of people need to get checked on. So just telling you this for y'all to be aware. Get aware of yourself, get aware of your surrounding, fix yourself. We continue. Does mental health affect the family?
Absolutely, yes. Mental health profoundly affects the family in numerous ways. It's not just the individual experiencing the mental health condition who is impacted. The entire family system can feel the ripple effect. Here's how mental health can affect families. 1. Emotional strain and burden. Increased stress, anxiety, and depression. Family members often experience heightened levels of stress, anxiety, and even depression themselves as they cope with a loved one's illness. A range of emotions. It's common to feel sadness, guilt, e.g., did I cause this? Anger, frustration, fear, and even resentment. Acknowledging these feelings is a crucial first step. Grief and loss. Families may grieve the loss of the person they knew before the illness, or the loss of certain shared experiences or future plans. Okay. Uncertainty and unpredictability. Mental illness can make family life unpredictable, with mood swings, behavioral changes, and periods of crisis creating tension. 2. Changes in family dynamics and roles. Role shifts. The illness can disrupt established family roles and responsibilities. For example, a parent who becomes ill might no longer be able to fulfill their primary caregiver role, leading to other family members taking on more responsibilities, sometimes prematurely, e.g., children becoming caregivers for a parent. Communication challenges. Communication can become strained. Family members might struggle to express their feelings.
So what they saying is communication, very important.
Or they might avoid discussing difficult topics.
People, I gotta cut this short. We talk some other time though. You stay up, stay good, stay positive, alright? Out of here.